Hi, my name is Wendy Chatfield. I've been a personal trainer for 24 years, going on 25 right now, and I'm really excited to talk to you a few things about pregnancy and exercise. I've had 4 children, and my children are a little bit older, but I really wish I would have known all of these things when I was pregnant. So the one thing I do want to say is if you are planning to exercise when you are pregnant, make sure that you are doing this at least 2 months before you get pregnant. The reason is because generally it takes a month or so to get into the habit of it, and that first month you're going to be really sore. And so I would say 2 months before would be ideal, at least, because then you won't be as sore and your body will be in the habit of it. And and then let's say that you get pregnant 2 months later. Your body's going to go through a whole bunch of different changes and all kinds of stuff that's going to be amazing, but it is going to be different. And so you're already in that habit before, and then you don't have to try and have so many new things. So I'm going to recommend, number one, that you walk for your cardiovascular exercise. So I'm going to recommend 3 things. Number one, that you walk. Walking can increase your cardiovascular endurance. It can increase your cardiovascular health. It can increase bowel motility. Something you may suffer with when you're pregnant is constipation. And one way to get the bowels to move is to walk. And it doesn't have to be a long time. It can even be 10 minutes. Break it up 2 or 3 times a day so you get 30 minutes total. But that will help with the bowel motility. It will improve your mental health, just being outside. And I also recommend sometimes walking around in your yard or in the park on the grass with your bare feet and getting some grounding in. That can be really helpful for your mental health. And then it also can help improve your blood sugar levels. And so possibly prevent gestational diabetes. That would be coupled with your nutrition and a couple other factors, but it's one of the ways to prevent it. The other thing I'm going to recommend is for you to strength train. Once again, remember, a couple months before you start, before you get pregnant. So strength training can increase your muscle mass and decrease the potential of you having sarcopenia, which is where you start to lose muscle mass. Especially if you're really sick, especially in that first trimester, you will tend to lose muscle mass, and it will be quick because it will be the first thing that will go. And so I recommend getting your muscles strong before you even start is going to be a game changer for you. And then it will help improve your baby's weight. And they've even done studies to show that it improves your baby's lean body mass, which is their ability to gain muscle. And then it will improve your stamina, which, just energy reserves throughout the pregnancy. And also, my recommendation is work on your posterior chain. So your posterior chain, just think of everything down the backside of your body. So your back, all along your spine. Support your spine by doing spinal exercises. Bird dogs, lat pulls, 1-arm rows, anything where you're going to have to pick up a car seat or pick up a baby. Think about how strong your back has to be. Your glute muscles, your hamstring muscles, your calf muscles, all of those need to be strong in order for you to be able to legitimately pick up your baby safely without hurting your back and or pick up a car seat. I can't tell you how many times I've had people come to me with hurt backs just from simply switching the laundry from the washer to the dryer, and they just moved wrong. And that generally is because they have a weak core and a weak back. So work on that posterior chain. And then the last thing I'm going to recommend is for your nutrition. I would recommend you to make sure to increase your protein intake. It takes a lot of protein to build muscle and to make a human. So increase your protein intake. And then second of all, please, 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 this is probably number 1 in nutrition. Increase your electrolytes that you're drinking. There's 5 different electrolytes that help with energy, but make sure that you take a quality electrolyte. This will also improve your milk supply afterwards. And if you're having morning sickness and you just can't keep anything down, and your symptoms are going to get worse if you're not hydrated. So electrolytes keep you hydrated. Well, those are my 3 tips. cardiovascular exercise with walking, weight training, and make sure you're focusing on the posterior chain, and then nutrition. And make sure to start 2 months before you get pregnant. That would be my advice.